What's up, everybody? Welcome to the show. Performance Medicine Show is here. We're welcoming everybody in. Happy Thanksgiving. Happy Thanksgiving week. Happy Black Friday week. What's up, everybody? Stephanie in Kingsport, what's going on? Happy Thanksgiving. Hope you guys are having a wonderful week in the Kingsport office. D. Lim, what's up? Roel, great to see everybody. Lisa, thank you so much for sharing. Love all the sharers. Thank you guys for sharing it's not a broad, I guess it is kind of a broadcast, sharing the show. Bianca, what's going on? Happy early Thanksgiving. Great to see everybody. We're live on YouTube, Facebook, and Dr. Rogers LinkedIn. Welcome in all the LinkedIn folks if you're with us. We're having a busy week, so lots to talk about. We're super excited. Jack, what's going on? Carol, hello. Great to see everybody. Happy Thanksgiving. Happy early Thanksgiving. It's Black Friday week. It's a busy week at Performance Medicine. We're running our biggest sale of the year, and we're having a blast. Dr. Ike is coming. Dr. Ike will be here. We hope. We hope. I guess I shouldn't promise that, but we hope. We hope he's going to be ready. Thanks, Jack, for watching. As D. Lynn says, share and smash that like button. Thank you. Anyways, we had a busy week today, or a busy day today. As you guys know, we send out the Performance Medicine weekly email. We call it the Performance Weekly, and has all of our best content all into one email. And today was a really, really jam-packed one. And this one was so much fun. It was an episode of the Common Sense MD. You can see that Dr. Rogers got to sit down and chat with Dr. Dan O'Rourke and his partner Nolan Hensley from Trinity Heart and Vascular Group over in the Tri-Cities. It's a cash-based cardiology group. Really fascinating discussion there, guys, around healthcare in general. Around cash-based practices. Some of you guys know Performance Medicine is a cash-based practice. So they talked a lot about what that means, and more specifically what that means for the patients. So I would love for you guys to check that out. And then we had a part 2 episode with Jamie Winship come up, and this is it right here, the Intuitive Mind Part 2. Where Jamie talks with us about dealing with roadblocks, going up into the intuitive mind, having dreams, and then coming down, making those dreams practical, and then dealing with setbacks. So dealing with any sort of roadblock, as he calls it. And I'm going to put this up here. We had a part 1 last week, so I would encourage everybody to probably start with part 1. But even if you don't, they're really, really, I think, transformative conversations. I know has had a huge impact on me. I actually was listening to part 2 on my way home today. Terry, what's going on? Great to see you. I hear Katie, I hear you loud and clear. I'm going to get these up right now. We're running our biggest specials of the year, as you guys know, all week long. November 21 through the 25th. So you got a couple days left, everybody, to take advantage of these discounts. You can call the offices close to you. You can see there at the bottom each of those office numbers. And then me and Katie did a video. We talked about the Black Friday sale. We talked a little bit of the origin story around it. And we went into detail around the types of discounts you're going to get. We talk dollars off, what you can save, how people are taking advantage of it, how to get a hold of an office. Everything you need to know about this week, you can find in this video with Katie. So be sure to check that out. Along with, we'll kind of combine these two here. And if you have a question around Black Friday, go ahead and put those in the comments, because we got our team. We got Katie in here. We got Stephanie in here. We got the crew in here that can hopefully help you guys out. So are we ready to roll? Is it I'm thinking we're ready. That means it's podcast time. All right, let's see here. Let's see if I can get Doc in. What's going on, man?
Hey, man. Hey, I love your haircut. Wow.
Thank you.
That's a new style for you.
It's a new style, and I went different. I wanted to try something new, and you know, I think people will get a kick out of this. But my hairstylist found a new part for me, and
it is a new part.
It's a new part.
Yeah,
you know,
I like it. It looks almost like skateboard. You know.
Normally I'm that way, but now I'm that way. And so we found a new part in the crown, and I'm happy to kind of roll with that.
Yeah, it makes you look young. It really does.
How's your day today?
Great. Had a busy day, great day, and getting ready for Thanksgiving. How about you? You going to come home and eat turkey with us?
Yeah, I think I'm gonna head in tomorrow night. And hopefully stay with you guys. Is that still cool?
Oh yeah, definitely. Definitely cool.
I don't know how Ike will be, you know. So
I hope Ike will come on the show. Yeah, Ike's sitting right over here, so we'll get Ike in here tonight. We'll sit around and watch some Hallmark movies tomorrow night, Ben.
Did you know this is a fun little? We're a big Santa Claus family with Tim Allen. And they have a new series out on Disney Plus. Did you know that?
No.
Yeah, it's called the Santa Clauses. Oddly enough, I've gotten into it. Who would have thought?
Yeah, I'll have to watch that.
Yeah,
I like a new series. I like
Disney Plus. Tracy, happy early Thanksgiving to you. Thank you for being here. Rita, happy Thanksgiving. Terry, happy Thanksgiving. Bianca, is that true? Yeah, I think Bianca's saying you and I are looking more and more alike.
We are.
Yeah.
I wish my hair looked that good. I can't do that with my hair, you know, like you do.
You could do it. You just got to put a little bit more time into it. And
yeah, maybe I could train my hair to do that.
Give it a chance.
Yeah.
Give it a chance.
Do you have to use a blow dryer on that, or does it just comb out? You have to use any Dapper Dan, like Dapper Dan?
I do use some Dapper Dan. I don't blow dry it.
I love Dapper Dan. I mean, you know.
Well, Pop, I know they're not here to hear about my grooming regimen for my hair. They're here to get some health and wellness information. So, guys, if y'all have a question for Dr. Rogers, go ahead and put those in the comments. We're going to get to every single question tonight. Welcome everybody into the Performance Medicine Show. Let's start with a aspirin question. This came over on Instagram. How do you feel about aspirin to prevent heart/stroke issues in your 40s? Good question.
I like it. You know, if you watched my video today, my podcast with a cardiologist, Dr. Dan O'Rourke, we talked about that a little bit because I certainly am a believer in taking an 81 milligram aspirin, you know, to prevent heart attack and strokes. I've been doing it since I was 40, and I think it's a great idea, especially if you have some risk factors. Usually I'll put men on it at 40, women at 50 as a general rule, unless they have an ulcer or they bruise too easily, or or if you're really old and ataxic to where you're going to fall and hit your head. But there's just so much evidence to read about that it's helpful. Most of the cardiologists I know take one, and it's kind of controversial, you know, just like vitamins. Every once in a while, a report will come out saying it doesn't help. You know, you just see some ridiculous things out there. But all in all, we know it's a blood thinner, and it causes your blood not to clot, especially in these, you know, viral days that we've had in the last 2.5 years. It's a great idea to take an aspirin to prevent blood clots. But there's also some good evidence that it may reduce your risk of colon cancer by about 40%. So, you know, you should take that odds anytime. So unless you have a good reason not to, if you have risk factors for being, you know, for uh, heart disease or stroke, which is all caused by atherosclerosis, usually caused by soft plaque that ruptures and forms a clot. That's how most heart attacks and strokes come about. Not all, but the majority. So I think it's a great idea. And if you have a problem with it, like you bruise too much or your stomach hurts, then don't do it. But certainly, if you have risk factors and you get to that age, because hey, age is the main risk factor for almost anything that we see. I was talking to Dr. O'Rourke, who's a cash-based cardiologist. The first one I've heard about. He took a big leap of faith, and gosh, he's really good. He's helped a lot of our patients out already. When can you get in to see a cardiologist the next day and get a complete heart workup? I mean, it's just fantastic what he's doing. So, and he has offices in Johnson City and Greenville, Tennessee.
Mm-hmm.
So it's such a good podcast. I really enjoyed talking with him about, medicine in general, not just cardiology, but why we do a cash practice, why I've been doing a cash practice for 17 years, and, how much it's made my practice better, and it's made me a better doctor. And go listen to that podcast. It's a really good one.
One of my favorite parts of that conversation was the part where you ask him, how would you work this? The example was a female who I believe had some symptoms. I believe just fatigue, things of that nature. And you asked him how he would work that patient up, and it was fascinating. Just the detail in which he went into it. It's really cool. It really shows you how they think as providers. It was cool. I really like that one.
Yeah, if you're extremely fatigued or you're not breathing like you used to, then you need to get your heart checked out. I saw a guy like that in the office today. His EKG was okay, except for some sinus tachycardia, but I think he probably has some underlying heart issues, and we're going to send him for a workup. Fortunately, he was not having a heart attack today, but I'll tell people always, this is a board question for any doctor or medical student. What is the most common symptom of a presenting heart attack? You know that answer, Ben?
Well, I do. I do, just because of the podcast episode today.
Okay.
But
I did mention that. Sudden death.
Sudden death.
That's the most common presenting symptom of a heart attack, sudden death. So that's why you want to get it worked up and maybe take your aspirin and make sure your blood pressure is good, and, get your CT calcium scoring, your Cleveland Heart Panel, because atherosclerosis is a process that every one of us has, starting from our teenage years. We're building up plaque in our arteries.
Is that what that word means?
Is that what?
Is that what that word means?
What word?
Atherosclerosis?
Atherosclerosis. Yeah.
Atherosclerosis means building up of plaque.
Yeah. Hardening arteries. Yeah, it is. Yeah.
Super interesting. Great conversation. Definitely recommend you guys checking out that conversation with Dr. O'Rourke and Nolan Hensley. Let's get to the next question here. This is timely. What vitamins and or meds would you recommend to treat the flu?
That's a great question. And whenever you start coming down with a cold, a sore throat, flu, anything, whether it be bacterial or viral, I always really pop up the vitamin D. That's the first one I do. Mm-hmm. And I'll take 50,000 of D every day for 5 days. For any adult, 50,000 units of vitamin D. That's not too much, believe me, for 5 days. And then I'll double up on the C. I usually recommend you take 1,000 to 2,000 vitamin C tablets twice a day, and zinc 50 milligram. Plus, there's a lot of other stuff you can do. That's herbal, like elderberry may help. There's a lot of evidence that it does. So those are the main ones: D, C, and zinc. And then drink a lot of water, drink a lot of fluids, get out in the sun if you can, get some fresh air. And certainly, if you think you're coming down with the flu, get a flu test. We treated several cases today over the phone. Boy, telemedicine's been fantastic. We treat a lot of people via telemedicine these days. It's really convenient, and they don't have to come in, especially when they're sick. We can usually tell what's going on with them. So get a flu test, because we can use, antivirals like Tamiflu if it's flu. We have ways to treat this. So, but those are the main ones that you think about.
It's a great question. Vicki, I see your question. Thank you so much. Kathy, I see your question. Mark, what's up, man? Great to see you. Chuck, I see you, man. Thank you for being here. Okay, let's get to, this is a very interesting question. I know several people that have been diagnosed with hypokalemia, which is low potassium. They seem to have developed sometime after having had COVID-19. Can you tell me the cause/connection between low potassium and COVID-19, and then what can be done?
Yeah, that is a good question. And we have seen some of that. I've seen quite a few people with COVID and after COVID for even several months that have had hypokalemia, low potassium. And the cause connection, nobody really knows for sure, but there's been a lot of postulations about it, whether those people don't eat they don't eat right. COVID can definitely cause some digestive issues, especially diarrhea. And you can certainly lose potassium by getting diarrhea. Even decreased oral intake. A lot of people lose their taste and smell with it, so their appetites decrease. They don't eat as much and get the potassium through their foods. One thing that I've thought about and read about that is really interesting, that may be the major cause. I don't know, but when COVID-19 hits you, it really enters your cells through this thing called an ACE2 receptor. We always talk about ACE inhibitors, which are blood pressure medications. But that's the way this virus gets into your cells, is through the ACE2 receptor. Angiotensin converting enzyme is what it's called. And it gets kind of deep in the woods, kind of complex. But that angiotensin renin system that you think that, is responsible for regulation of most blood pressures, which it is, when the virus gets in there and kind of interferes with that enzymatic process, then it has a lot to do with potassium uptake as well. And so a lot of people think that that's the reason why these people have low potassium. And again, low potassium can cause cardiac arrhythmias. It can cause you to feel really tired. The main deal is cardiac problems, and I suspect it's caused a lot of them. The treatment's pretty simple. You give potassium and you monitor it. So if anybody comes into my office, I had a guy like that today, and I drew a stat metabolic panel on him. Fortunately, his potassium was okay, but he was definitely having some long COVID symptoms, pretty severe, and enough to make me worry. I even did an EKG on him and the stat blood test. But so you just give potassium, which is over the counter, probably 20 milliequivalents is about the average dose, and then make sure it's corrected. And again, that hypokalemia could last for a few months. It really could. And it may in fact be responsible for some of the long COVID symptoms that we're seeing. So definitely you need blood work. So great question. You must be taking a deep dive into that, because we have seen that.
Great question there, guys. Welcome everybody into the Performance Medicine Show. As you know, we're taking live questions tonight. We're getting ready to dive into the comments here. So if you have a question, for Dr. Rogers, go ahead and put in the comments for us.
One other
Lynn,
thing, Ben, I was thinking about it. I want to mention is that when you think about potassium, we see a lot more hypokalemia in women than men. Sometimes it's because they're on a diuretic. Women tend to retain fluid easier, so it may be because a lot of them take diuretics, but I see that more in females than I do males. Just an interesting note.
Can you say that word one more time? I know it was in the question. It is
hypokalemia.
Hypokalemia. So you see more of that in women?
Yeah, I do. Okay. Post-COVID. Yeah.
Thank you so much for that question. And that's going to do it for the questions that came in throughout the week. If I missed you, if you sent in a question and I didn't get up there, please don't be afraid to shoot me an email right now. I've kind of got my eyes on all the different contact points. So I apologize in advance if I've missed somebody, but I'll have an eye out for my email. It's ben@performancemedicine.net if you want that question in anonymously. But if you're okay with it, go ahead and put your question in the comments, and we're going to get to a few right here. Robin, happy Thanksgiving to you. Thank you for hanging out. Brenda and George, I see you. Coal miner's daughter, great question. I see you. All right, let's jump in and see what we got here. I believe I saw one from Bianca, if I can find it. There we go. From Bianca, what do you recommend for restless leg syndrome and leg cramps at night? If you answer magnesium, what's the dosage? I know this is something that a lot of people deal with. So thank you, Bianca, for
that's
for bringing
a great question. And you're right. The first thing I think about is taking some magnesium. And I really prefer magnesium malate. That's my favorite form for cramping. There's about 9 different types of magnesium, but that seems to be the one that I like the best for cramping, and restless leg and seem to be associated with leg cramps a lot. They're kind of different, but if it's true restless leg syndrome, then a lot of times we have to go to a prescription medicine like Mirapex. But in general, the general dose of magnesium's 400 to 500 milligrams. I think the malate may be a little different milligram. I'll have to look and check that out. But because 500 of citrate may be equal to a little bit less of malate. And when you're taking too much magnesium is if you get diarrhea with it, then you need to back off on the dose. But restless legs are pretty common disorder. Nobody really knows what causes it. Leg cramps, of course, can be caused by low potassium, for one thing, and more commonly, low sodium. So some people that don't eat enough salt will get leg cramps. Another over-the-counter thing you can do for leg cramps is quinine, which you can get in tonic water. But for restless leg syndrome, if nothing over-the-counter works, you may try a medicine it's a prescription medicine called Mirapex. That's probably the most common one that I see. But people that have restless leg, they just move their legs all night long, like they're running.
Do they know they're doing it?
Sometimes they do, sometimes they don't, but their partner who's in the bed with them will know it. And sometimes they wear the sheets just out because of that constant motor movement. Yeah, there's Katie. It's 115 milligram of magnesium malate, which is equal to about 500 of the magnesium citrate. So thank you. I knew it was a little bit lower dose, but it's more bioavailable than the mag citrate. But that's a great question. It's really common. That's one reason why I like wearing my Oura ring. It tells you how restless you were at night, how much motor movement you had, what time it was, if it's associated when you had low oxygen saturation. So it can be a clue as to whether you may have sleep apnea. That is a great question. There's a lot of wives' tales and over-the-counter things you can do for it. But try the magnesium malate, and especially if the other forms of magnesium aren't working for you, maybe some quinine, and then make sure you check your electrolytes, do some blood work to make sure sodium and potassium and renal function are good. And then if that doesn't work, you may have to go to some of the more potent, even Parkinson's medicine. That's what Mirapex is. And sometimes I even use it just to relax, or like Klonopin, which unfortunately is a long-acting benzodiazepine. So you have to think about habit-forming nature there. And sometimes I'll use a mild muscle relaxer that sometimes works. Tinizidine is probably my favorite with that. It'll help you rest as well, especially if you have a lot of muscle spasm in your lower back. That seems to work pretty well. So I hope that helped you. Those are some things that you can try.
What are you looking at for restless leg in your Oura Ring? I'm looking at my sleep from last night. Is it which is it? Restfulness? Is that the
Movement.
actual?
Yours probably doesn't do it. Yours is a Gen 1. Mine's a Generation 2. So
But
it shows.
What does the Gen 2 show?
It shows oxygen saturations, which a Gen 1 doesn't show. And I'm looking at mine right now. And it correlates with your breathing regularity. Yours probably doesn't have that, Ben.
So
And
breathing regularity, that's
Yeah.
tied to restless.
Well, that's one thing, but it also, mine shows movement. And last night I had no significant movement during your rest. So
Really?
I had a pretty good night's sleep last night. There's if you want to look at it, can you see that? That's a pretty good night's sleep.
I'm telling you, it shows. You look great. Like you look well.
Thank you, Ben. Yeah, my sleep was 89 last night, which I rarely get an 89 on that. So it's pretty good.
Guys, put your questions in, guys, because Dr. Rogers is in peak shape right now. He got a great night's sleep, and he's ready to answer some questions. So he got an 89.
My brain's working good because of I love this Oura Ring. You really ought to consider giving it to some people for Christmas. They're about $300, but I love my Oura Ring. I mean, it just tells me so much about, what I should do. I mean, I had a good report, and it'll actually tell you if you need to go hard that day or you need to kind of recover. So I just love my Oura Ring.
Just to give you an idea, my sleep score was a 65 last night.
Wow.
My readiness is 74. But Katie just mentioned mine is a Gen 1, and it is a hand-me-down. So shout out to all the hand-me-down Oura Ring users like myself. If Carter's here, I think she's one of us. A hand-me-down Oura Ring user. Let's get to Chuck's question. Chuck is saying, "Good evening. I'm taking gabapentin as a sleep aid." A lot of sleep questions tonight. I have read it can cause weight gain. Is this true? And if so, can I stop it cold turkey? Great question.
Yeah, it definitely can cause weight gain. I'm not sure I would use gabapentin as a sleep aid. We use that medicine. I put somebody on it today for diabetic neuropathy, but it's pretty potent because it makes a lot of people tired. That's why you're using it for sleep. But a lot of people get dragged out in the morning by it, depending on what dose you take. As you start out at 100 milligram and work the way up from that if you need it for neuropathy. So for chronic pain and neuropathy, it works pretty good, but it definitely causes weight gain and fatigue. Now, it just depends on the dose and how long you've been on it. But I mean, you could stop it cold turkey, and I don't think you're not going to have withdrawal seizures on it or something like that, like you would Xanax or one of those type of medications. So you could, but if you're on, 300 milligrams, some people take, 1,800, 2,400 milligrams of that stuff. And if you're up on the dose, I would definitely taper off of it. And if you're just taking 100 milligram, you can just stop it. But if you're on 300, go down to 100 for a week, then 100 every other night for a week, and then stop it. But so it's not, I don't think it's that hard to get off of, but I'm just not sure I would use it as a sleep aid, not unless you have some other reason you're using it. But it can be a beneficial medicine, but it does have some side effects like weight gain. There's no doubt.
Chuck, hope that helps, man. Let's get to, let's see, where am I at? Let's go to Vicky's question, then I'll get to Kathy's. Vicky's asking, what do you recommend for gastritis flare-up?
Well, first thing I would do is look at what you're eating. You know, like my doctor used to tell me, if your stomach's hurting, quit eating. So give your stomach a rest. So eat a very bland diet for one thing. But I'm not against if you think it's too much acid or some kind of food has gotten, your acid up and you have GERD, reflux, then I'm not against using even a PPI for a few days, like Nexium or Prilosec. I prefer the H2 blockers like Pepcid. That's my favorite one there. So you can certainly do that. Even just putting a little bit of baking soda in water will calm your gastritis. But try to find out what's causing it and what your history is. Look at that if you've had ulcers before. If it's chronic, you probably need to get a workup to make sure you don't have a bacterial infection called H. pylori. But if it's just temporary and it's something you ate, I'm not against you using the acid blockers temporarily. Sometimes I use Carafate, which just kind of coats your stomach. You can always start out with just a Pepcid AC. I mean, all this stuff except for Carafate is over the counter. You can try it, but avoid fatty, spicy, greasy foods while you're trying to get over this, and eat a very bland diet. And hopefully it's just an acute thing, and it'll clear up really soon. But if you get into a lot of problems with your stomach, and then you start doing have bloating and irregular bowel movements, you need that worked up. Robin will tell you need a GI map, and I agree with her.
All right.
And a probiotic. Use some Digest Shield. I mean, that's the best gut pill I've ever seen. I started probably 5 people on it today. When people come in your office and they have brain fog, fatigue, they hurt a lot, and you look at their inflammatory markers and they're up, which was the case with one of my new patients today. A lot of inflammation. You do everything you can to find the cause of it and to calm that inflammation down. And I put this lady on Digest Shield, and she'll do really well with it. It just covers a lot of the basis of this. It helps GERD. It helps gas, bowel movements. It just settles that gut microbiome pretty well. And I'm big on Digest Shield, as you know.
For this patient, did you recommend 2 per day or one after?
2 per day. 2 per day.
So 2 biggest meals?
Yeah.
All right. Thank you so much, Vicki, for that question. Let's get to Kathy's question here. What are your thoughts about the research saying that basically all long COVID patients have microclots and how to treat it? I understand D-dimer is not positive unless clots are breaking up. Do you do the following testing for it at your office that could show it? Serum amyloid A, alpha-2 antiplasm, von Willebrand factor, E-selectin, or PCAM.
Man, you pronounced all those really well. Not routinely. You can do an advanced coagulation panel, but and those are things that could affect it. But I've run a few of them, and I rarely find anything that's positive out of them. And the insurance usually doesn't cover them, and it's very expensive if you end up paying for that. But so what I usually do is end up going ahead and putting people on aspirin, of course. And sometimes even with acute COVID, if you have a lot of risk factors, I'll put you on even Eliquis. And I usually, we talked about aspirin before, 81 milligram, but if you're heavier, you need more than 81 milligram, especially for in a situation like this, if you have long COVID. But yeah, there's no doubt in anybody's mind that COVID was a blood clotting disorder, and that's how it killed most of the people. So anticoagulants are very helpful. I had patients that had positive D dimers, and I followed them. I had patients that I was sure had blood clots, microclots, and had negative D dimers, probably because of what you said. They're not breaking up, but certainly aspirin. If you don't want to take aspirin, nattokinase, lumbokinase, serrapeptase, all are pretty good natural blood thinners. You can do that. May have some other benefits as well, but I usually don't take a deep dive into these because, it's just I rarely get a lot of positives on it, and then, what are you going to do? The same thing you just did. Somebody has von Willebrand's or some, factor C or that type of thing. They're usually going to go see a hematologist anyway. I do people that have a positive MTHFR genotype, the 677 TT genotype, like I do, are more prone to clots too. Those people ought to be on aspirin, in my opinion, or at least one of the others like nattokinase. So that's a great question, though. There are a lot of panels that you can do that if you want to get real academic about it, you can certainly go searching for it. But before I run any extensive test, I like to know what I do about it if they turn positive anyway. Something I'm probably going to do anyway, put you on an aspirin. But then if you got some really genetic type blood dyscrasias, then I'll send you to hematology and let them work it up a little further and determine whether you need a long-term anticoagulant like Eliquis or something, Brilinta.
Kathy, thank you so much for that question. I'm going to get to Coal Miner's Daughter on YouTube. Do you think energy drinks contribute to heart attacks or other heart problems? Interesting.
That's a good one. Well, I think there's a lot of caffeine in them for sure. Some people flush a lot when they take energy drinks because of the niacin in them. And you can overload even with vitamin B6. If you're taking a B complex that has a lot of B6 and you start drinking a lot of energy drinks, you could overload with B6 and it could cause neuropathies and that type thing. But I certainly think it could be a factor. You're hearing recently about all the heavy snows up in Buffalo, 7 feet worth of, 24 hours, 7 feet of snow. There were several deaths, people that shoveling snow by having heart attacks. And who knows, they may have been drinking energy drinks. If you overactivate your sympathetic nervous system, you could certainly cause some hypertension, tachycardia, and you could precipitate a heart attack. So be careful. I don't like those energy drinks a whole lot personally. I just don't like them. I like a little bit of coffee, but everybody has their tolerances. I think a lot of the people that drink energy drinks are kids because it may interfere with your sleep at night too. And I'm just not big on the energy drinks.
Really interesting discussion there around energy drinks. Thanks so much for that, Coal Miner's Daughter, for putting that in there. Let's get to Brenda and George here. What do you recommend for colitis?
Gosh, it just depends on what kind of colitis. If it's ulcerative colitis, which is a very serious autoimmune disease, and it's basically inflammation of your colon. And I mean, some people even end up getting their colons taken out because of this. So get on it early, get a diagnosis. Usually you need a colonoscopy with a biopsy to determine what it is. A lot of times you'll be having bloody stools and maybe even mucoid stools. But I always put people on an autoimmune diet. I've told the story before, but this several months ago, I had a 60-year-old lady that was just diagnosed with ulcerative colitis by her gastroenterologist, and he wanted to put her on methotrexate or Humira, and she looked up the side effects and plus the cost of the Humira, and she didn't want to do it. So she came to me to get my opinion, and I asked her a question that I knew the answer, but I just wanted to confirm it. I asked her if the GI doc ever asked her what she ate, and of course the answer was no. So that's what I always start out with, an autoimmune diet. What you eat and see if you can calm it down, but get a diagnosis. A lot of people will use the heavy hitters like methotrexate, which is a chemotherapeutic drug, or even Humira, which is a biologic. They'll definitely calm it down, but again, they can have side effects like depressing your immune system for other things. So, get a diagnosis and find out why, and then treat with anti-inflammatory. Some people use sulfasalazine, which is the old-timey way of treating it, which is a form of, believe it or not, it's related to aspirin to calm that down. But get a good diagnosis, and if you have colitis, you really do need to see a gastroenterologist to see exactly what it is. Is it ulcerative colitis? Is it Crohn's? You need to get a diagnosis on that. And sometimes you have to end up taking the heavy hitters. I like LDN, low dose naltrexone, if you want to think outside the box a little bit, which I use for a lot of autoimmune diseases. What else do I like with that? I usually like an autoimmune diet, which we have copies of in the office. Anything that will prevent inflammation of the lining of your whole GI tract. But LDN, and there's one other I was thinking about using. I can't remember, but I would definitely get a GI map and look at your gut microbiota. I would definitely take something like Digest Shield and try to balance that out and look at it. And people that have ulcerative colitis can be prone to have colon cancer too. So you definitely need screening. But think about low dose naltrexone. That's kind of one of those outside the box things that we use. And I don't know why I'm blanking out on the other one that I sometimes will tell people to take. BPC 157. That's a peptide that I like to use. Another one that's kind of outside the box. So think about those. Get a workup.
Brendan, George, hope that helps. We're going to go to D. Lynn here on YouTube. Let's see. What do you know about Fabry disease? It's popped up in my husband's family. I'm going to request his doctor check him. I just don't know what to ask for. It was discovered when his cousin had a stroke. I love these types of questions just in terms of how do we talk to our doctor about this? So I'd encourage anybody to think this way.
I don't know much about it, but I'd have to, that's something you read about a little bit in medical school, but you never see it. I know it's genetically passed on, and it can cause a blood clotting disorder and cause strokes, but I'm not an expert enough to tell you. I'll guarantee you, if you go on and start searching it, you'll know way more than I do by the end of this night. But definitely, because your family doc's probably not going to know a lot about it. You're going to have to probably see a specialist. And even like I had a patient today who has a young child that has some problems with having what they think was a stroke or cerebral palsy, and is seeing a geneticist for it at Vanderbilt. So that's one of those things, those odd things that you probably need a real specialist to investigate. And so I don't know much about it to be able to give you any good answers for that, and I'm not sure how, whether it's an autosomal recessive or I don't know much about it, but do your research and talk to somebody who does.
Thank you for putting that in there, D. Lynn. And I've written that down. We'll kind of keep up with you and see how you're doing with that, because I know that's, any sort of family member coming down with something like that. I know that can send you down a rabbit hole. So we'll be thinking of you, D. Lynn. Okay, let's get to Lisa's question. With using a Libre like I do, I'm assuming this is a Freestyle Libre. You can't take large/high amounts of vitamin C because it will cause high blood sugar levels. Would you know why?
Well, I think if you're taking oral vitamin C in normal doses, it's not going to affect it. But it is true that if you're getting an IV vitamin C infusion, like we give in the office a lot, you can't check your blood sugar and have you get any knowledge out of it, because it's going to be off. You just cannot trust it when you're getting high dose IV vitamin C. So again, if you're taking normal doses of vitamin C orally, I still think, it'll work. But I've had a couple other people ask me that same question. And I know with my 2 type 1 diabetic kids, they take vitamin C and they have continuous glucose monitors, and it doesn't seem to affect it. So, but that's a great question, because certainly high doses intravenously can definitely render those glucometer readings null. They don't mean much.
And I wonder too if Lisa's also maybe coming from the perspective. I know a lot of people get their vitamin C through powder, like Emergency, and I do think there's sugar in Emergency in there, if I'm not mistaken.
There probably is, but I don't think that's what she's talking about.
Okay.
But
Well,
she's
Lisa,
right. If you're taking high doses of C in your vein, it can definitely affect your blood glucose numbers. Matter of fact, they may be opposite of what you think.
It's interesting.
Yeah, really interesting.
Lisa, thank you so much for that. Great question there. Okay, let's get to let's see, Vicky's question with the thyroid question. Welcome everybody in. I know we're getting some people coming in. Welcome to the Performance Medicine Show. Vicky is asking, 43-year-old male with TSH level within range but low 1.19. Should we follow up with any other thyroid tests, and should we be concerned about this low result? And I hope I'm reading that result right. Does that sound right?
1.19. I guess the TSH level is 1.19, which is pretty normal. It's not really low. I mean, normal on most labs is anywhere from 0.3 to 4. But really, I like to have a TSH level around 1. To me, that's normal and optimal. But yeah, I mean, you don't need to look at just the TSH. You need to look at the free T and the free T4 at the very least. And again, when treating thyroid, I go a lot by symptoms. Sometimes I saw one like that today. Her TSH was 1.9, but she had every symptom in the book of a low thyroid, family history of it, and I drew some more labs, and I'm gonna start her on a little bit of thyroid medication, some NP thyroid at a very low dose, because she's symptomatic. I mean, she's running a low temperature, body temperature. She's constipated. She has dry skin, thinning hair, brittle nails, cold hands and feet, fatigue, brain fog, weight gain. So, in that case, you treat symptoms. So I look at symptoms, but if it's a TSH of 1.19 with no symptoms, I wouldn't worry about it. But certainly that's not a complete thyroid panel. But yeah, you should follow it, especially if they're symptomatic.
Vicky, hope that helps. Thank you so much for putting that in there. Great question around the thyroid. Kathy is asking, have you tried oxytocin nasal spray to treat long COVID tinnitus?
We use a lot of oxytocin in our practice, and again, if you can get the nasal spray, it probably works better than the oral or sublingual. But no, I haven't treated it specifically for tinnitus. That's a hard thing to treat. I don't know that I've ever treated that with anything that worked. That really just an eye-opening discovery. It's just tough to treat tinnitus, ringing in the ear. Gosh, that's a tough problem. I've had some family members with that, and sometimes they end up getting a hearing aid to mask the constant ringing in their ears. Certainly, if it's one-sided, you need to look at it a little more seriously than if it's bilateral. But if it works, then we'll use it. Yeah, I'd like some feedback on that. If you're having some positive results from it, it's a lot of out of the box type things do work. Like I did that podcast on post-COVID loss of taste and smell, and have used nicotine gum for some of my patients. It's helped about 50% of the time. So, but yeah, let me know if you get some good feedback on that. I don't have any experience with success with it for that purpose, but
thank you, Kathy, for putting that in there. We'll follow up with you. Welcome in Jasmine, our esthetician in the Knoxville and Fountain City offices. So good to see you in here. She's got some specials going on this week, so be sure to check out our specials around skincare and aesthetics. Thank you, Jasmine, for hanging out. Let's get to this is a question from Mark that's timely, and I think this tugs at all of our heartstrings. Every Thanksgiving, 1 in 6 people get sick. 128,000 hospitalized and 3,000 die from foodborne diseases. What are the early signs to look out for what treatment measures to be considered? I hope that I said that right. Seems that this is a Thanksgiving thing. Did I read that right, Pop?
I think you did, yeah.
What's your thoughts on this? It's very timely.
Wow. I mean, I didn't, I know there's a lot of people that travel. 48 million are going to travel tomorrow, I think. A lot of people are going to be killed by car wrecks. I think an estimated 550 people. I just saw that on the news. Look who just came up. Mike wants to get on the show early tonight. He wants me to play with him, I think. But yeah, that's surprising that many die from foodborne illness. Wow, that is scary. It makes me glad I'm not traveling for Thanksgiving. I think the main danger of traveling for Thanksgiving is probably car wrecks. Either that or getting into an argument with your in-laws and it ends up as a gunfight at your your turkey dinner. That happens a lot. Ben never thinks I'm funny. I throw a joke out and he's not even responding to it. I think he's looking at other things, but I was just kind of kidding about the gunfights at the dinner table. That doesn't happen. Certainly there's a lot of stuff that goes on with people getting into arguments, political arguments at the Thanksgiving Day table. So try to stay out of that this year. Don't mention religion or politics at the Thanksgiving dinner.
That's right.
And don't criticize the way your in-laws' kids are or whatever. Just try to be nice on Thanksgiving. Just give thanks that you're all together. But so I didn't know that many people died from foodborne diseases during. Wow, I don't know if that's in the United States or worldwide. I guess Thanksgiving is an American tradition, but early signs of being sick. I mean, if you get food poisoning, you're going to be sick within a couple hours usually. And it's going to be more than one person that's going to be sick. So things you got to think about: salads, especially potato salad, foods that have been left out too long. If they smell weird, if they taste weird, don't eat them. Certainly, I would always have some activated charcoal tablets around the house. You know, that's a really good measure for reversing food poisoning. So keep those around the house. And if one person's getting sick, try to figure out what it is and keep everybody else away from it.
Mm-hmm.
Well, he's really wanting to gnaw on my. Are we way into the podcast where he's here early tonight, isn't he?
He's here early. I don't know what
Oh.
he's so anxious about.
He just jumped up here, and
You
it's
know what?
okay though.
Maybe he knew that Robin's here. Robin Riddle, our nurse practitioner in the
Robin
Knoxville
loves
office, is
dogs.
here.
Loves
Robin,
dogs.
welcome in. Thank you for hanging out with us this evening. Of course, you guys know
Hey, Rob.
Robin Riddle is the star of Explain This. You can check all of her episodes out on our YouTube channel, as well as the Outside the Box podcast on Apple and Spotify. Robin, thanks so much for being here. We love you.
Thank you.
I want to put this up from Terry. Hope this helps some people. I love Digest Shield, and Life Extension also has a product called Esophageal Guardian, which supports gastroesophageal health. I keep this for times when I have sudden and stubborn reflux. Not especially pleasant to chew up, but works great. Thank you, Terry, for putting that in there. Like
that.
Terry
Yeah, I do like
did, guys, if you guys have anything that's really working well for you, this is a community. Put it in the comments. We're as interested as everyone in here watching. So, Terry, thank you so much for putting that in here. Let's see. Jasmine's going to be taking her Digest Shield for Thanksgiving. It looks like Matt's ready for Ike, and I think Matt's only here for Ike.
That's the only reason Matt listens. He just loves Ike. I think I'll send him over to his house maybe for Thanksgiving.
Robin is putting in here, slippery elm is great for reflux too. Thank you for adding that in there, Robin. It's a great suggestion. Anyone in here thinking about reflux heading into hopefully what is a wonderful Thanksgiving lunch, dinner. We're going to be eating a little more than we're used to. Let's see, there's Sonia. Is that what is
Sonia.
that around? Sonia, great to see you. Activated charcoal.
Yeah, you can get those at really any pharmacy or vitamin shop. You could probably order them off of Amazon. But yeah, it's just a great thing to have around, especially if you're going to be traveling. To a foreign country, especially where the water. As a matter of fact, I saw a patient today who had traveled to Punta Gorda. I guess that's the name of it. Everybody except her family, her immediate family in her hotel had food poisoning. And makes you want to, or I'm giving Ike a treat here. Okay. That's the only thing that'll settle him down. Look at those chompers. He really has some big teeth. And he'll nibble on you, but he won't ever hurt you. He won't ever hurt you. So he's just a lot of fun. He's getting big too. He's getting really big.
We're having some questions around slippery elm. If anyone knows in the comments where they're getting it from, where are you seeing slippery elm from, Pop?
Go get some slippery elm in my drawer. I've got some. Yeah, some in my drawer there. I have some in my cabinet. Gosh, I think I got mine at Max Medicine Mart.
And I'm seeing Robin saying that you can order the slippery elm lozenges online or most health food stores. So it seems we're looking for lozenges here.
I think people ought to also, like I talked about, a home medical kit earlier, and I think everybody ought to have a little Zofran around the house, sublingual Zofran for nausea and vomiting, and also maybe a little Imodium if you've got terrible diarrhea. Again, I wouldn't take the Imodium and unless you just couldn't stand it, because I'd like you to clear it. But for an acute viral gastroenteritis, but I hope Robin will probably agree with that. But anyway, those are things that are great. I also like some ginger chews. I have these little ginger chews that I get that really, if you got a little bit of heartburn or nausea, seem to help a lot. Ginger is just such a great product. I like ginger. But I definitely have some slippery elm in my little pantry, and activated charcoal for sure.
Steve, hope you and yours have a wonderful Thanksgiving. Please send Sheridan our love and your whole family. Steve, thank you for being here. Happy Thanksgiving.
Steve, happy Thanksgiving. And I'm going to start my journey towards learning how to make sourdough bread. I've got my starter. Thank you. And I'll be beginning my journey on how to make some sourdough bread, which is the only bread I'm going to be eating in the future, because it's really the only bread I like. And that keto bread, I just don't like the taste of it. I don't eat a lot of bread anyway, but certainly if I eat it, it's going to be sourdough. And since Steve has all the experience being a master baker of that, I hope it's fun. It's going to be my new hobby. It was guitar playing, but now it may be, if it takes a lot of my time, it may be turned into being a sourdough bread baker.
Are you still? You're still playing guitar though, right?
Oh yeah, I've been playing a lot. Yeah.
Well, Pop,
I learned a new Molly Hatchet song the other night.
Who's Molly Hatchet?
See, I knew you'd say that because you're so young. I bet Steve knows who Molly Hatchet is.
I have no idea who Molly Hatchet is.
Molly Hatchet was an old Southern rock band.
Oh, it's a band?
Yeah, it's a rock band. Yeah.
Interesting.
Kind of like Allman Brothers, Leonard Skinner type. The Molly Hatchet was famous, famous rock band, and I won't tell you how they got the name Molly Hatchet because it's not a real nice term, really. You know what? I will tell you, since everybody's listening. Molly Hatchet was the name of a famous prostitute who cut the heads off of her lovers. She decapitated them. Okay. Can't find the slippery elm, but yeah, look up Molly Hatchet. Actually, they're a great Southern rock band. You've learned a little bit of trivia here. Steve will know who they are because Steve.
It seems Coal Miner's Daughter knows Molly. Steve is more of a Dixie Dregs fan. All right, we got Ike in the building. So Dr. Ike is here. That's our sign. I think he's ready to play some game or something.
Yeah, he wants to play. He wants to watch some Hallmark movies, I think.
Ike, I'm going to see you tomorrow, buddy. Guys,
okay, thanks, man.
Hope everyone has a wonderful, wonderful Thanksgiving. We appreciate y'all hanging out with us on this busy Thanksgiving week. I'm going to put this up one more time for the people who are near an office or far. These are our specials. We're running them all week long. Our Black Friday sale is our biggest sale of the year. We're running specials on pretty much everything. So if you haven't already taken advantage of it, call the office closest to you. We're open till 3 o'clock in all the offices tomorrow. And on Friday, we'll be open starting at 9 a.m. And we're going to be, of course, running the special on Black Friday. So be sure to check that out. And if you want details, we did a full episode of Outside the Box on this Black Friday sale, detailing exactly what you're going to be saving and how to take advantage of these sales. And before we end here, I want to send it right here. Guys, check out this episode with Jamie Winship, going into the Intuitive Mind Part 2. You can tell just by the way I'm talking during this interview that I had a lot of revelations myself. So I hope to share that with some of you guys. So check that episode out. And we're going to be out. Chuck, thanks so much. Happy Thanksgiving to you, Coal Miner's Daughter. Thank you. Steve, we love you. Robin, thank you so much for being here. Jasmine, we love you. Stephanie, Katie, thank you guys so much. And thank you to all the performance medicine team. Our offices are crazy busy this week, and everyone inside of our office on our team is working extremely, extremely hard and going out of their way for all of our patients. So thanks so much to all of the performance medicine team in all 5 locations. And Dr. Ike is saying the same thing.
Yeah, he's excited. He's excited about Christmas. He really is.
All right, we're going to head out. Pop, I love you, man. I'm going to see you tomorrow.
Love you too. See you tomorrow. Be safe. Bye-bye.
See you guys. We're out.